Hi, everyone. This is Brian Zimmerman with Becker's Healthcare. Thank you so much for tuning into the Becker's Healthcare podcast. Today, we're on site at Becker's Payer Roundtable. We're going to talk about the future of member experience, engagement, efficiency, and outcomes. Joining me for today's discussion is Sadie Rizzuto, Vice President at Enterprise Technology Solution Implementation with Humana, and Stuart Langley, Senior Vice President of Client Services with Everise. Sadie and Stuart, thank you so much for being here. To begin, I'm going to tap on each of you to introduce yourselves and share a few pertinent details about your professional background and your organization. Stuart, why don't you kick things off?
Sure. So my name's Stuart Langley. I am SVP of Client Services at Everise. And Everise, we are a full services BPO providing contact center, back office, and technology services. And we have a specialism in the healthcare space, working with wonderful clients such as Humana.
Excellent. Well, with that, that's a perfect transition over to Sadie then.
Sadie Rizzuto, Vice President for Technology Enablement and Readiness within our insurance operations space at Humana. Within Humana, we focus on our Medicare and Medicaid population and how we improve our health outcomes within those members. I am responsible for several product teams, including our enterprise CRM and knowledge management populations, and I'm also responsible for our artificial intelligence program for insurance operations.
Excellent. And Sadie, we could begin with you with this next question. So when we think about predictive models and leveraging those to deepen member engagement, it's not just about sending more messages, but driving meaningful action. Can you talk about how you're thinking about that at Humana?
One of the key things with our predictive models is understanding how to meet members where they're at and when they are there and how we make those interactions count. And it's really around quality over quantity, how we guide towards the right programs based on what we know about those members. And the key to that is how we use the data that we have. We use our predictive models to understand their engagement levels and their styles. One of the key examples we have of that is, for example, medication adherence. Medication adherence is one of the key STARS scores. As a lot of payers know, that's one of the 3 weighted STARS measures. And some of the key examples around med adherence is around social determinations of health, transportation challenges, financial challenges. The data that we have around our members helps us understand what are some of those key examples of those what are the members running into challenges with, and how can we bring information forward, and when we're talking to those members, that could help them change those outcomes sooner rather than later. Those behavior patterns are really critical, and the predictive models help us understand which members we need to change up the conversations with.
Yeah, thank you, Sadie. It's Stuart. What Sadie just shared? How does that sort of align with what you're seeing among Everrise's other partners, and what are your thoughts here?
Yeah, absolutely. Across the different payers that we're working with, mainly they're in different stages, but everybody's working to the same set of ideas of trying to build these big predictive models and trying to really get proactive and get ahead of the need instead of waiting for members to call in, which helps smooth out the staffing that's needed to support things, but also makes it more frictionless for the member.
Mm-hmm. And that friction that you're speaking to, that claims friction, is a top pain point for members as well. Stuart, can you expand on even how you've seen automation or AI materially improve that experience? What have you seen out there?
Absolutely. So to your point, when people are going through a claims process, typically they're already in a high stress situation.
Right.
They're dealing with a healthcare issue or maybe an emergency. So anything that you put in the way of them getting to care is just adding to that frustration, adding to that stress. Something as simple as through the app, not just when someone's looking for care, having it list up a set of providers that can provide that care, but allowing them through that app to directly reach out and schedule that care. Mm-hmm. Just takes a step out of the process for them, makes it a little bit easier, makes it a little bit more intuitive, and eases that friction for the member.
It's such a good point that they're going through a challenging experience, because people can get frustrated just when they're calling, their bank about an automated thing versus calling somebody about their own health. The stakes get higher. People get a little bit more tense, understandably so, right?
Yeah, definitely. For me, grew up outside the US and moving here a few years ago and trying to navigate the healthcare system, it's not the most straightforward process. And anything that we can do to remove some of that confusion, make it more straightforward and ensure that people are getting the right outcomes and the most cost-effective outcomes is a huge benefit.
Yep. Sadie, can you expand on this? How you think about leveraging AI automation to really improve this experience?
One of the ways that we're looking at that is also, to Stuart's point, recognizing that, especially at that claims interaction point, is when the members tend to be at one of the difficult moments in their life, is how we also smooth it out from the provider side. And how the provider is interacting with the members using intelligent data automation to reduce the friction between payers and providers from an accounts receivables perspective is going to help the providers be there for the members as well. In 2023, there was identified that there was an opportunity of over $800 million in payments and over $1 billion in remit advice if providers were able to get to a full digital adoption for reconciliation. So there's huge opportunity out there for payers to work with providers to smooth out those friction points. That only brings value down to smooth out those points for the members. So as we continue to create those interaction points between the providers and payers, it's just going to bring that down to the members as well.
Yeah, and can we talk about, speaking to sort of some of Stuart's points, just the navigating some of this stuff is really hard, and claims education is another thing that's really challenging and very complex, but very important to do, especially help folks understand their benefits, the care they need, make sure they're getting the care, also understanding the right side of care. Like there's just so much that goes into education here. Can you talk about, Sadie, any tools you've seen that have actually simplified education, member education, specifically as it relates to sort of open enrollment? Seems like a specifically challenging moment for folks. So anything you can share there?
Yeah, that plan education with members is something that we are continuously looking at. How do we shift that as far left as possible in working with members and beneficiaries? Understanding, very similar to where we're talking about meeting members where they're at, and using the data that we have with members, either with their current plans or even their previous payers, understanding how they want to be engaged with, and using predictive models to understand where they're going to engage more effectively, whether that's with inbound engagements, outbound engagements, or even digital engagements. That's going to help us understand, how do we get in front of potential health gaps? How do we help them understand what are those plan opportunities that they may not know about, like transportation benefits that could help them get ahead of things, that whether it's medication adherence, like we were talking about a minute ago, whether it's other services that they don't know that they have an opportunity that they can tap into, sometimes even before their plan effective date. So by shifting those conversations further left, and in a way that the member is going to engage with us in a way that maybe they didn't know about, and ways that we know that they're going to step up sooner because that's how they are more apt to engage with us, is one of our big focuses. And we get that by using the data in a more proactive manner.
Yeah, big component of education here is letting them know what they've got, because sometimes they've got coverage for things that they didn't realize, and I imagine finding out about that is a positive experience as well. Stuart, what would you add to this?
In addition to the areas Sadie was covering, another important part for us, we do build in our Ever AI labs. We're working with our clients to build technologies, AI, that can directly outreach to the members. But another important area for us is we've got a large contingent of advocates in our call centers, and due to the seasonality, you're onboarding people for the season each year. So building tools that can help those advocates get to the right information, maybe by doing predictive intent modeling and understanding what a member might be calling about before they call in, or just improved AI-backed tools to support knowledge bases, to improve the training process for the advocates, allows them to be more informed and allows them to provide a much better level of experience to the member, getting to the information quicker, resolving in a single call something that previously might have taken a few calls to call in, all of these different areas come together and improve that member experience.
Yeah. And what you're laying out here, there's a deep need for it. It's a very exciting opportunity to be able to give this to members. But of course, we wouldn't be talking about healthcare if we weren't talking about hurdles and potential challenges. So we should honor those and talk a bit about those. Stuart, we can start with you. What compliance or regulatory hurdles are going to prove most challenging here? And how can folks navigate those without losing momentum and really still being able to take advantage of this really excellent opportunity?
One of the areas, funnily enough, that I've seen as a challenge is you've got a bit of a friction between marketing groups at companies such as ours who want to plaster AI on everything that they're doing in the marketing material, and technology groups who rightly are looking at risk and have concerns around how AI is being used. AI is an umbrella term. It means a lot of different things to different people. And it's very important to be very precise in what we're talking about, because you may have a solution that is truly generative AI interacting with the large data set that includes member information that really does need to go through a full regulatory body and understanding what the implications are before it gets deployed. But there may be another technology that's kind of AI or has very controlled AI use in a completely ring-fenced setup that doesn't need to go through that full setup. And you can have a situation where you've got a great tool that you want to deploy that's going to deliver fantastic either cost reductions or improvements or an experience. And it sits in the back of the queue waiting to go through that full regulatory review that probably could go through a faster, smaller setup. So for me, that's one of the areas that's important is education. Education within our business to understand what we're really talking about and being a little bit more precise as we define what these tools and technologies are and what they do.
Yeah, cutting through the umbrella term, right? So that people don't just think AI. We gotta check this out. This is going to take time, and they can then be more, like you said, intentional with how you're educating about certain solutions. Sadie, what would you add here?
I think to Stuart's point, one of our biggest challenges is actually our internal governance. And that's part of why, not only AI, but technology is moving faster than ever before in our lifetime right now. And you need to have really strong dynamic partnerships within legal, risk, compliance, and your technology organizations internally to keep up with those changes. And they have to be ready to evolve and look at, from a multifaceted perspective, what are all of those things that are changing? And you have to look beyond your current industry and understand what else is changing and start looking ahead. You have to start looking at what else is happening across the technology, across in industries that maybe you wouldn't anticipate outside of healthcare, and how that could be what's coming up in the next 6 months, 9 months, a year ahead, so that you can be ready for that to start influencing the healthcare industry. And that's how we're going to start being able to both understand and partner within governance, our government policy makers, to start planning ahead and making sure we're getting the right outcomes for our beneficiaries. I think that's also how we make sure we're staying focused on the problem at hand and not necessarily focusing on the shiny object, which helps us get ahead of some of those advertising techniques.
Yeah, focusing on the actual needs of your members and not just the technology in of itself. Technology for technology's sake. Yeah. It was a real pleasure getting to speak with both of you today. Before we sign off, I'll open it up to each of you to share any closing thoughts with listeners. Sadie, you can go ahead and go first.
We were just talking about, making sure you stay focused on the problem at hand, even if it's not the sexy one. I think it's staying on that same topic. You need to be, we talk about, across the industry, folks are talking about being agile and failing fast, but you really have to live that and be willing to pull the plug if you're not seeing the outcomes that's expected. We're seeing that a lot with AI, that you have to be willing to say, if you're not seeing the outcomes that you were expecting, and make the changes that you need to see. That's really critical to get to the outcomes that are expected. There's a lot of big promises out there. If you really want to see the outcomes, you have to be able to make the tweaks and pull those triggers as you go. And that's really critical, and be comfortable making those big changes.
Yeah. Stuart, what would you add?
It's been a fantastic conference here. Hearing a lot of speakers up on the stage talking about similar areas around the technologies. Obviously, it's an exciting time. It's a challenging time, but I think another area that's important with such a rapidly developing set of technologies, it is easy to get distracted by the marketing spin that's being put out there, and for everybody to try and jump on the next shiny object. So it's easy for companies to get kind of a fractured strategy where they're getting all these promises. There's so many companies reaching out, and they're jumping from solution to solution and kind of over indexing on trying a bit of everything. And maybe the best approach is to pick a couple of key partners that you can work with, that you have trust with, that you have experience with, that understand your business needs, to your point, so that you can partner on a strategy. And understanding these technologies, they're evolving so rapidly that they're going to leapfrog each other in terms of the immediate deliverables. So having that slightly longer term view can get you to better outcomes instead of just getting drawn in a thousand directions and getting nowhere.
And you need a partner that's willing to take that long-term view with you.
Absolutely. And invest with you and partner.
Excellent. Well, Sadie, Stuart, it's been a pleasure speaking with you today. I want to thank you both for coming on the podcast. I want to thank Everise, of course, for sponsoring this episode. You can tune into more podcasts from Becker's Healthcare by visiting our podcast page at beckerspodcast.com.